22, ChatGPT released. April 23, first Epic released their first AI models. So then the journey went very fast. In about mid of the 24, the first European customer went live on those Epic models, also mainly the patient answers messaging. And in summer 24, they started with generative AI using AI assistant, inpatient summaries, outpatient summaries. By January 26, 85 customers are live with Gen AI on Epic. We are one of them. We are just piloting, but we are also investigating some of those use cases, and I will show you now what's going on. So now a little bit a complicated slide, but I think it's very important to understand the technical layer. So everything which is Gen AI and cognitive computing is powered on a Nebula cloud. It's called Nebula infrastructure on a cloud because the computing storage is needed. And so how this works is every patient data is lying on-prem, Intel servers normally, but for Gen AI and cognitive computing, there's encryption powered by Cloudflare. This goes to an Azure cloud in Switzerland, where most of the cognitive computing models run. And then for Gen AI, there's an additional layer, mostly because of more power they need, which is the Azure cloud in France, and this is a multi-tenant. So there's a lot of security layers in between. And this is now crucial because with our data protection, you all know this, the canton of Bern is very strict on Switzerland, and there are like predictions that you cannot use Microsoft Azure clouds in Switzerland anymore to do AI if it's sensitive data. So how this works, the encryption keys are all had by the encryption keys are all had by Epic and Intel. Nobody can access them, even under the Cloud Act. You would need a lawyer and a judge to make a lawsuit, and then you can get access. The second layer, and this is in the Azure cloud, there's a customer lockbox approval. Whenever Microsoft or Epic needs to access this data to help us troubleshoot, then we need to give them access, and we need to provide them the access and give them the access rights. And on the Azure cloud in France, there is no data stored at all. The data stored in the Azure cloud in Switzerland is between 7 and 30 days. Right now, everything is under 7 days. So now let's talk about the Nebula features or the AI features of Epic. There are over 150 predictive and AI, Gen AI models of Epic in the world. In Switzerland, there are available 60 around, maybe now already 70. And you need to all go through the process to really approve them. And we'll show you soon. So we are really doing this in waves. We are started with the first wave in October last year. And so now we are in the second wave. So this process takes really long, but these features are coming so fast that you are not able to do everything. You know, you need to really do an assessment. We have a structured assessment. What is physician effectiveness? What is patient flow? What is the data protection, security risk, and all that stuff is like kind of measured, and then we decide which features we put on. Right now, we are about 15 features which we evaluate. The blue ones here, this is the predictive AI. This is mostly patient flow, how high is the risk of likelihood of ED admission, or how likely can you discharge the patient by tomorrow or by the day after. So these are very basic things. This is not fancy, but this is just to get a little bit used how these things work. We are coming to the clinical use cases. I will show you later only 3 or 2. We are looking especially in efficient effectiveness. So what brings the physician time back to focus on the patient? What brings efficient time back to get the data seen they need in a very fast manner? How do we do that? There's a clearly strict process. So we start with an analysis of data security and data protection, because in some of those cases, we need to go to the data protection authorities, to the Vorabkontrolle. So we will identify each data category, it is factual data, pseudonymous data, or is there any sensitive data? Honestly, most of the generative AI models, if you make inpatient summaries with notes, sensitive data, you cannot guarantee. Ambient listening, sensitive data. So there we found a way for sensitive data that for now we take the patient consent in writing, that they agree, so we can use those use cases. Then we start with the second phase in calibration. This takes us 1 to 3 months. So we take keen physicians who are already used to Epic, who are physician builders, clinical informatics specialists, and they use this model, and then they get feedback, give feedback, they get meetings with Epic, and we make the model work. And then we go to a validation process, and this is then the scale up in the clinic, so using 5 or 6 users from the clinic, and then the next step would then be scaling, so broad rollout. So basically, we are all here in the phase 2 or phase 1, so there's nothing really broad live. So what is real, and this is pretty new, Epic has native AI charting, and this is only the beginning, I will show you later. So ambient listening in an ambulatory setting, which makes not only captures the physician background, and it's native in Haiku, no integration, it also predicts orders. So the medication can be ordered, CT scans can be ordered, and all that stuff. This is new functionality coming in May. Right now, it's more the conversation. First feedbacks, it works pretty well in Swiss German and High German. It doesn't make a lot of hallucinations. And right now, we have Epic on place, and they really go with the physicians into the visits, and then they make very, very fast adapting to prompt when something is not working. So after the first things, we can say, yes, it's working. It's not like for produce, but I think it will be in production very soon. It also can do individual preferences. You can also say, okay, do it always the same for my diabetes care office visit. Do it always the same for this other office visit. So this is where we are, 25 test users for the next 3 months, and then we will see how far we can go. Same story, inpatient insights, same for outpatient insights. So this makes a summary of the patient chart from the last 36 to 24 hours. What is the gain? It summarizes recent events like emergency visits, vital signs, medication which have changed, changes in documentation. And this shall time save the physician to say, okay, when I come in the morning, there I run through, and all my patients have a short summary, and I can quickly see what's going on. Especially helpful if you're working on the weekends, you don't know the patients, and then you have a good summary. Every AI thing from Epic is like with notes, you always can go to the reference where it's coming from and see this in line if you want to. This is on the right screen. So this was started in November 25, and it's just also piloted right now. Then we also wait a little bit for the Data Protection Authority to really give us I think that this is mostly pseudonymized data, so we can use it maybe without patient consent. Census forecast is something just from the prediction models. This is not very fancy. It just predicts you the projected bed count for the next 48 hours. This is nothing where you do bed planning. This is more for nurses and nurse clerks to say, okay, do I need everybody tomorrow? And this gives you a little bit more confidence. Okay, we can leave somebody at home. So this is like also in 2 clinics piloted right now, not a very fancy thing. It recalculates every 15 minutes. The goal here is that it makes forecasts for the next 13 days. So this will be the next step. So it makes a forecast for the next 14 days. This is something for the researchers. I don't know if anybody knows Slicer Dicer. Slicer Dicer is the data model underlying Epic. We have different models, patient model, referral model, surgery model, cardiology model. And normally you need to know each model and say, okay, I want to see in the patient model, give me the diagnosis. So right now you can now write prompt, give me all patients with a diagnosis of appendicitis who got surgery in a laparoscopic appendectomy for the last year. And then it already makes you this, and you can say, make me a graph, make me an export, and all that stuff. So this is coming soon. We are evaluating it with our data stewards, and now we will see how good it works. This is something you can turn on because it's factual data. It just summarizes the model. This is something which doesn't need to go to the Data Protection Authority as far as we think. So what is next? Again, this is something which will help the physicians. They always ask for text assistant, making like corrections, shortens the text, makes it more patient language-like, and in future also translate. This was just not available right now, but also there was the assessment. This will give time back to the physician. You don't need any integration. It's native there. It summarizes your notes, and then you can go. So we will test this from May because it's coming with the next upgrade in 2 weeks. This is then something which we really focus on for the next half year. This is chart search, which will do a full text search also in the archive system, which is Synedra. This is one of the major problems. Okay, you get a bunch of PDFs. The patient is coming with 20 letters. And if this is in the archive, an EPIC can search for it and make a summarization and also get structured data out of it, like medication or diagnosis, then I think it's also very helpful for the physicians. This is planned for Q3 because there needs to be integration work done with the second vendor, which always is complicated. Yes. But what is the vision? And this is maybe my last slide. So the vision of EPIC, they will provide at some point, I don't know how fast it goes, a really autonomous intelligent ecosystem. So you have like a physician assistant, this is art, ambient, but also ask the chart, give him the last lab values, it provides it. Make a nice summarization of that. So this is really the agent factory EPIC will provide natively in the system. Same for the patient. The patient can ask in my insel, what was the result of my last X-ray, or can you tell me this in a patient-friendly language. All this is very, very difficult to implement because you need to be very sure, especially with the patient, that this works. On the other hand, they built like their own language models in a framework which is called Cosmos. I don't know, maybe somebody heard of it. It's the biggest autonomous database in the world with 300 million patient data. We don't use that right now. We are still thinking how we can participate there. But this is the future. EPIC will make predictions on recent events, on events like how high is the risk of getting a heart attack in the next 3 months compared to this patient population. So this is a little bit fancy, sounds a little bit like science fiction. I think personally this will work at some time, but this is maybe the next 3 or 5 years what is coming. And this brings me to the end. Thank you.